I'd like to share our experience on the prevention of diabetic foot in Singapore. Singapore is the second highest proportion of diabetics amongst the developed countries next to the United States, not something we are proud of. We adopt a two-pronged strategy. Strategy one is prevention of complication by providing patient education and food screening. And strategy two, when prevention fails, the food complication that develops is best treated by a diabetic food team, which we have formed since 2004 and using. Prevention is the key to diabetic foot problems. 25% of diabetics develop ulcer. 84% of non-traumatic amputations are caused by ulcers. The key to prevention is education, education, and more education. Education is almost 90% of prevention. Who do we educate? The patients and caregivers 80% of the time, but professionals too, 20% of our time. Annual food screening accounts for perhaps 10% of prevention. Patients must be educated on what topics? Number one, care of diabetes. Many patients do not know diabetes. So they must understand diabetes, then only they can take care of diabetes to prevent complications. Number two, care of the feet. Many of our patients have poor hygiene. Number three, use of proper shoes for protection. Many do not wear protective shoes outdoors. We have developed these education materials for patients, Knowing Diabetes, Happy Feet, A Guide to Footwear, since 2014 and use them on our patients. We have translations in Malay, in Tamil, and in Chinese. And this is available in the Sri Lankan Journal of Diabetes under the appendix of the Asian guidelines published there in 2015. The first one, Knowing Diabetes. The things you need to know. What is diabetes? Diagnosis, treatment, healthy lifestyle. What is diabetes? More than 8 millimoles per liter, the ineffectiveness of insulin. What are the signs of diabetes? Always thirsty, sudden weight loss, frequent urination, always hungry. Excessively high blood glucose, breathlessness, fatigue, nausea and vomiting, persistent infections. Low blood glucose are problems too. The symptoms, mental confusion, dizziness, trembling hands, loss of consciousness, fatigue. The long-term effects of diabetes due to narrowing and hardening of blood vessels, atherosclerosis reduces the blood flow, leading to stroke, blindness, kidney disease, heart attacks, diabetic foot. Diagnosis by performing fasting blood glucose, normal 6 millimoles, diabetes 7 millimoles or more. Medication, injection for type 1, for type 2, oral tablets. And you must be on time and take them regularly. Regular monitoring must also be performed, always monitor using a glucometer, and these are the recommended readings. What do you do if the blood glucose, if you experience blood glucose symptoms which is low? Well, like these fainting spells, trembling hands, fatigue, eat or drink something sweet. It's important to keep your weight in check. The BMI must be in check. What are the regular checkups that you should have a checklist for? HbA1c, eye check annually, food examination annually, urine test annually. It's important to follow a healthy lifestyle, diet, control your intake of carbohydrates. Diet, follow the healthy pyramid lifestyle, fats, oil, sugar, small amounts, meat, 3 servings, fruits, vegetables, 2 servings, rice, 5 servings or more. Regulate the carbohydrate intake, I think not more than 1,800. Choose low-fat options, cooking methods, broiling, boiling, steaming, and so on. Drink 8 glasses of water per day. Exercise regularly. Exercise lowers the blood glucose level. How often should I exercise? 30 minutes per day, 5 days a week. The types of exercises: lower body stretching, other exercises, brisk walking, uh, aerobics, swimming, even line dancing. Tips for the exercise pre, during, and post. No smoking, very important. Stop smoking or risk your life or risk your feet. No alcohol. Drinking limits for diabetics, females, 1 drink, males, 2 drinks per day. We must be responsible, make the right choices, and then can live a healthy life. Coming to Happy Feet is a step-by-step guide we have provided. Every 20 seconds, somebody loses the limb, so it's very important. So this can be avoided with proper foot care. Step 1, hygiene. Keep the feet clean and dry. Wash with water and mild soap. Wash in between the toes. Don't use powder in between. Skin care, use moisturizer to hydrate the skin. Don't put moisturizer in between toes, maceration, and so on. Use a soft cloth to dry them. Nail care, trim the nails straight very carefully, and so on. You must also have a first aid kit to make sure that you use them when slightly the foot gets injured. It's important to step 5, look at the foot. All parts of the foot, underneath the foot may be a problem, use a mirror. Now, if you cannot reach the feet, get a caregiver to assist, and so on. What are the warning signs? Pain, redness, abnormally hot, bad smell, ulcer. Debunking myths. My foot problems not serious because they are painless? No. All right to test water temperature using the feet? No. And so on. And it's usually the checklist. What are the things to avoid? When you go on holiday, there are other things to look for. Be careful about trolleys, and in beaches, wear footwear, proper sandals, and worry about rats and so on. The third part, a diabetic's guide to footwear. What makes a good shoe is important. Shoes are important. What makes a good shoe? Back of the shoe must not collapse. Broad shoe box. Good cushions. The sole must be firm to support the feet, and the heel must be firm to support the ankle. What makes a bad shoe? Slip-on shoes, high-heel shoes, slippers, tight shoe boxes, thin-soled shoes. Do's: shop later in the day for shoes, try shoes with socks. Don't buy fitting shoes. Buy shoes made of synthetics? No. Buy shoes that fit the larger foot? Yes. Avoid shoes interior seams, and select a shoe based entirely on pre-measured shoe size? No. Wear cotton socks before wearing your shoes, and check the shoes for wear and tear. And check also for foreign bodies for damage to the shoes. Common myths: all right to go barefoot? No. Massage slippers improve blood circulation. Only need 1 pair of shoes. Fit snugly around the entire foot. These are all wrong. Now, the other pillar of prevention is annual foot screening. All newly diagnosed diabetics must receive annual foot screening, just as we receive eye, heart, and kidney. Detailed medical history, clinical exam, pulses, EBI, TBI, SDWT, King's classification, risk stratification, and then we give advice on foot care, advice on footwear, and refer to the specialist podiatrist, ortho, vascular, endocrine, if necessary. The features of foot at risk: peripheral neuropathy, PAD, callosity, inability to reach the foot, or visual impairment. And here we can follow the algorithm by default regarding how regularly we should examine these feet. We have a shortage of podiatrists in Singapore and in the region, and Malaysia, Indonesia, Thailand, Philippines. We run training courses for assistant nurses or technicians to do our food screening. And we have several of these food screening courses. And by 2010, we have already trained more than 102 nurses, half for Singapore and the rest for the region. We are very happy when in 2016, the Minister of Health declared war on diabetes in Parliament. And he and the Education Minister co-chairs the Diabetes Prevention and Care Task Force because they realize how important diabetes is. On 5 battlefronts: prevention, screening, control, understand diabetes, and do your part. Conducting public awareness is a massive responsibility. We have 5.7 million requiring educational talks in schools, colleges, face-to-face talks, but nowadays more online talks because of COVID, educational talks on radio and television, features in daily newspapers in all languages, advertisements in cinema, shopping malls, MRTs, buses, and taxis. We need government involvement, not just Ministry of Health and Education, but also Ministry of Culture, Community and the Youth, Ministry of Communication and Information, Ministry of Family Development. And more than that, we just need to set a joint ministerial task force, not just with the ministries, but also to include doctors, nurses, and other health professionals in the primary healthcare sector and in the major hospitals, if we are to succeed. This is our algorithm for prevention of diabetes. Education 90%, food screening 10%, but central to this is government involvement, and fortunately the government has committed themselves for battle for education, healthy lifestyle, screening, control, and treatment. So in conclusion, the key to the management of diabetic foot is prevention, and the key to prevention is education. Patients and caregivers and educating professionals, coupled with annual food screening 10% of the time. Public awareness program is a massive undertaking requiring a national program with government support. Only then can we succeed. Before I end, I would like to say a few words about our Association of Asia Pacific Association of Diabetic Foot Problems. This is formed in 2004 in Singapore for professionals dealing with diabetic foot problems. We have 13 member countries from Australia to Malaysia to Singapore to Vietnam. Our current president is Dr. Hari Krishna Nair of Malaysia. Our future conferences this year will be by Dipsicon in India, Goa, and next year will be in Melbourne, Australia, and in 2024, it will be in Singapore, 20 years anniversary, 20 years after we started this adventure. I would like you to join us in all these conferences. And if you're not a member, please fill in this application form, send it to me. I'm the secretary. I will process and I will send it to the treasurer, and you will hear from Ms. Gillian Butcher, our treasurer, regarding the payment process. The life membership fee is only Australian $140. We welcome all members. Thank you, ladies and gentlemen.